HealthEdge Solutions is a customer of both Pure as well as Portworx, and Kendra McCormick has been gracious enough to come in and talk about, really, she's going to talk about their journey. Kendra, can you come up, please? And we'll just talk around here. We're just making it impromptu. I wanted to first introduce the company, and so people have a context for what it is you do and what your size of the problem is, and therefore they can associate them. So I've got to get the clicker, so if you don't mind, sorry about that. So it's clear as to whether they can make a connect in their minds about what it is they are going through and whether your experience is very useful for them. So thank you very much for joining us here.
Of course, yeah, absolutely. So I can tell you a little bit about HealthEdge. HealthEdge is both a software development and a hosting provider. We own and develop our own healthcare software. Our software, at least my division of the business, is focused on claims adjudication, repricing. So what that means is when you go to the doctor, have a procedure, fill a prescription, in that pharmacy or the doctor's office, somebody has to check your health plan and what's covered, what's not covered, what your copay may be, and then that goes back to your health insurance company and they do the same cross checks. They may pull out something that doesn't process properly, et cetera. And so that health insurance company, the hospital where you may have a procedure, those are our customers that are using our software to perform those functions. It's really important to you as consumers and patients, right? Because you want to make sure that your coverage is available when you need it and it's priced properly, so you're not paying more money out of pocket than you should be. And when you have questions about your coverage, you want to have a clear layman's term answer to understand what your coverage may be and what your financial obligations may be. So HealthEdge's software, I particularly work on health rules payer is my sector of the business. And I manage a team of 8 engineers onshore and about 10 engineers offshore in Pune, India. And my team is responsible for everything from the operating system back to the physical data center. So operating system including security updates, all of that stuff, the infrastructures, the servers, the networking, all the way back to the 2 physical data centers that we have, one in Massachusetts and one in Ohio. And with the understanding of what our software does, I'm sure you can understand that uptime is really, really important. Because if you go to the doctor or you go to the pharmacy and our software is down for our customers, that means that you may not be able to get the services or the prescriptions that you need. So 24/7 business, our companies are required to meet compliance with Medicaid and Medicare, which are very, very strict. Full HIPAA compliance, so security is really important. And we need to be able to do that fast, right? And so healthcare is a lot of data. My business in particular is committed to making healthcare data available to patients forever. So that's a lot of data that continues to grow. We continue to gather more and more metrics about our patients, and that needs to grow. So we need a place to put that, and we need a place that can process that and make it accessible at a very quick rate. But at the same time, it's important to us to reduce the cost of our operations so that we can pass that cost savings over to the patients, right? You don't want your healthcare costs to go up. And a piece of that is your health insurance company, and a piece of that is your health insurance company using a software like HealthEdge, HR Payer, to be able to process claims very quickly with as little human interaction as possible.
Yeah, so the thing, when I was reading about HealthEdge a little bit more to understand their business, in North America, or particularly in the US, if you think about the number of healthcare companies that are there that provide these sorts of insurance programs and coverage for patients, 120 customers is actually 120 healthcare customers is a sizable deal, and so it seems like close to a fourth of the U.S. population is covered by HealthEdge solutions for healthcare customers. So that's really an important company, and has been around for quite a few years with a few acquisitions along the way to put together these kinds of software-based solutions for them. So with that, Kendra, if you don't mind, describing your kind of journey and your applications, your solutions, and where you started your journey for containerization and kind of why, and then we can talk about what the results were with it.
Yeah, absolutely. So I've been at HealthEdge for almost 5 years. At HealthEdge, we like to joke that's like a lifetime because we do so much, we do it so fast, and so much change has occurred for HealthEdge in the last 3 to 4 years, even during COVID. When I joined healthcare, we were technically a startup. We had 325 employees. Today, HealthEdge has acquired 3 other businesses. We are now about 3,000 employees. And have gone from about 25 customers to over 100 customers across those business units. So it's been a very quick journey in the last 3 years. All those acquisitions happened during COVID. And so, the whole going back to the office debate was not a debate for us. We don't have enough chairs for butts, right? Because we've expanded so much. But that expansion has happened so quickly that we need our technology to be able to scale as quickly as our business has. But at the same time, we don't want the financial commitment to scale at the same rate, right? We want that to scale slower. So we have had to very quickly turn over our technology. We're still very much in the process, but we're going from a hyper-converged, all flash, but hyper-converged nodes to our pure arrays with Lenovo nodes for compute. So with hyperconverged, if you're not familiar, you basically buy a big rack and it includes all your compute, all your storage, all your networking, your heating, your cooling, all of that, one big node. Well, most of those, especially the platform we're on, that's about $150,000. Well, what if you just want to expand your storage? You have to pay $150,000 and expand your storage, your networking, your compute, et cetera. So that very quickly drew us down the pure line because we were already all flash, so we wanted to stay all flash. That was not up for debate. But we needed something that we could scale our compute at a different scale, or a different pace that we scale our storage. So we still have some of that hyperconverged, and actually I was telling him that during lunch today, I found out that we finally completed the POs to double our pure footprint to 4 petabytes as a service. We're an Evergreen 1 customer. And what that means for me is we're pulling that hyperconverged out of my SaaS data center completely. We're going all orange, right? And this is a big deal for my team because we are trying to explore new paths like cloud computing in public cloud. We're in an Azure space and as well as containerization. With containerization, much of what we do, like our software, the software itself is the same for all of our 50 HRP customers. Where it's different for each customer is their database, right? The individual data that's available for that customer. And because of HIPAA compliance, we use network segmentation to maintain separation between those customers' databases. But does that mean that we have to have 50 instances of our software that looks the same? Right now it does because of that segmentation. And that's where we come to containerization. If we can containerize HRP, we can have a handful of instances of HRP that then reach out to the customer's databases and still maintain that network segmentation, right? So what we're talking about is not reducing headcount, but limiting the need to expand headcount, right? Which then brings down our operating costs, which then we pass off to our healthcare customers. And it allows us to scale faster because we really just need to look at scaling the database, not the database and a number of attached third-party applications as well. And it allows us to speed up our upgrades, reduce downtime, because with the containerization, you can do real-time upgrades. And because we upgrade our software, typically customers get an upgrade from our software, either a maintenance release or a version release once a month, typically. And so with containerization, we hope to speed that up and make that more resilient for the customers and hopefully almost zero downtime.
Yeah. So the scenario before you went into containerization was this. 100, I just captured the information based on our discussion. 100 total DB instances, 50 customers, every month, because there is an upgrade process, you were going through a planned outage, so there are instances of outages and so forth. So since then with containerization, I wanted to, have you talk through the experience and what that meant in terms of real impact for the business. So.
Yeah, it's been awesome. So the data he's showing here is particularly one third-party application that we use. So if you think about all of the information that's in your health insurance software, a lot of that requires addresses, right? Because taxes are different by your address and regional costs are different. So every patient may have at least one street address. Every provider has at least one street address. Every hospital, every health insurance. There's a lot of street address data, and we need to make sure that is accurate. So there's a third-party software called Melissa Data, which basically provides us correct address data with monthly upgrades to make sure that we have all the correct legal addresses. Traditionally, before Portworx with Pure, we had an instance of Melissa Data for every single one of our HRP customers. So that's 50 instances. That's an application server that also includes typically 2, sometimes 3 copies of that database. And that database is large because it's every street address in the continental United States. And we had to do that 50 times. So that's a lot of storage, right? And that's where we're saying at least 50 database instances. That's just for this third-party tool. And it's one of many third-party tools. So, and that database gets updated once a month to make sure we have all the current stuff. So we have an engineer, an application engineer that would sit down every month and go to each individual instance for each customer and upgrade that database. And what that meant was pulling down another copy of the new database with the 2 old copies there just in case, applying the new database, and saving a second copy of that database in case there was an issue with it. And doing that 50 times every single month. It's a lot of man hours. It's a lot of, I call it monkey work. It's not skilled work, but we have to have skilled engineers in there. And what we've been able to do through containerizing Melissa Data is we have one instance of the Melissa Data application and 1, maybe 2 instances of that database. Because again, that database looks exactly the same for all 50 customers. Why do we need 50 copies of it? Well, we don't with containerization. So Portworx with Pure has allowed us to reduce that. So that's 1 monthly upgrade on a single instance of the database in the application versus 50 previously. So that was typically about 400 man hours a month to do that upgrade. It is now down to 4 hours a month. And it's starting to shrink because we're able to do it even faster.
That's fantastic. And you're just beginning the journey right now.
Yeah, so that's one third-party application. We haven't even done that with HRP yet.
That's right. So Kendra, I know that you're starting the journey. We want to be a part of the journey for all of your and help you all through the process. But I think that's illuminating for the group here to understand how like Murli mentioned in the previous presentation, which you weren't at, that you always start small, get your wins, and then build from there. So that's a good example of it.
Yes. And I want to scream that from the rooftops. I think that's difficult for business leadership to understand. We in particular in the healthcare space have gotten a lot of pressure from our customers, like, why aren't you guys in the cloud? Our customers don't even really know what that means. They just think it's the next best thing, and we're laggards if we're not in the cloud. So my leadership is like, let's get to the cloud, let's get to the cloud. And I'm like, hey now, our application is CPU heavy, it's compute heavy, it's storage heavy. What's the most expensive thing in the cloud? Storage and CPU, right? So does it make sense to push HRP, our main application, to the cloud? When we also don't internally, we haven't grown processes and skill sets around the cloud, so we're still learning. So does that make sense? I personally don't think so. I think, like you said, take the small wins. Let's look at third-party tools that we're currently doing that are very consistent, low maintenance, low resource. Let's put those in the cloud. Let's see what that looks like. Let's see how that improves other business process. And let's allow our engineers to learn from that experience before we start putting the big guns out there, right? And I think what we're learning from that is that maybe it doesn't make sense for HRP to go to the cloud. Maybe it makes sense to put our third parties there. And we're going to have some customers that never want to be in the cloud. We're talking healthcare data, right? A lot of people don't necessarily trust the cloud with their personal healthcare data. So we're always going to have to be, I think, partially in the data center. Even if we get HRP in the cloud eventually, I think we'll always be in a hybrid place. And again, that's where Portworx and Pure has helped us, because nothing we do with Pure will limit us from putting some workloads in the cloud or putting them there and pulling them back if we want to, if we decide it's not a right fit. It gives us that flexibility to decide what's best for our business and start with those small wins and learn from the experience.
Fantastic. Thank you so much, Kendra. Appreciate
Of
it
course.
greatly. Thank you.
Thank you. Thank you, guys.